again, everyone. Welcome to Fayette Regional Health Talk. I'm Renee Nesbitt.
And I'm Doug Fischesser. Thank you for joining us. As always, Health Talk is made possible by TV3 and Fayette Regional Health System, so viewers in the Whitewater Valley can be better informed of the health and wellness topics and opportunities in your area.
That's right, Doug. And Fayette Regional Health Talk is also your source for up-to-date health, news, and events that are important to Connersville, Fayette County, and the entire Whitewater Valley. Leading this edition of Health Talk is a reminder that Fayette Regional's team includes many specialists in fields such as oncology, cardiology, pulmonology, pain management, therapy services, and more, with dedicated doctors and nurse practitioners committed to bringing excellent health care to Fayette County and the surrounding area. Fayette Regional is excited to offer Genu 3D mammograph exams utilizing advanced breast tomosynthesis technology. Genu's exams are clinically proven to significantly increase the detection of breast cancers while simultaneously decreasing the number of women asked to return for additional testing. We'll have a guest in studio later to tell us more.
Fayette Regional and St. Vincent's offer the power of 2 hospitals for your heart's health. The heart is the most important organ in your body. The heartbeat can be detected as early as 12 weeks and continues to beat 100,000 times every day of your life. If you have a heart problem, come to the best heart program in Indiana. St. Vincent's is rated as Indiana's #1 cardiology group, and they are here for you with 7 of Indiana's best physicians and nurse practitioner on staff. It's the power of 2 hospitals for your heart's health, providing unmatched quality and expertise in cardiology.
Fayette Regional is a leader in physical therapy and injury rehabilitation, and our team of certified professionals are committed to getting you back to peak performance for life and sports. On the go, on the job, or on the court, the smallest of injuries can stop you in your tracks. That's why Fayette Regional is here for you with certified athletic trainers and physical therapists working with your doctor to develop your custom treatment plan. Quick treatment from Fayette Regional can lead to a quick recovery to get you back to the active life you enjoy. New patients are being accepted. Visit FayetteRegional.org to learn more.
Fayette Regional's Pulmonology Center offers the area's premier sleep medicine center, offering diagnostic sleep testing in a comfortable home-like setting. Studies show that people who get 7 hours of restful sleep each night lead longer, healthier lives. However, millions suffer daily with sleep disorders that lead to health problems including high blood pressure, stroke, and heart attacks. If you snore or gasp for air while asleep or are often tired during the day, don't ignore the warning signs. Contact the Fayette Regional Pulmonology Center. Learn more at FayetteRegional.org.
Fayette Regional Laboratory Services now offers several screenings at discount cash pricing. You don't have to make an appointment and you don't need an order from your doctor. Direct access lab testing is now available with over 20 different screenings to choose. Results are quick and sent directly to you so that you can share them with your doctor. When we return, our guest will be in studio to help give us a few more details about direct access testing at Fayette Regional. We'll be right back.
Fayette Regional and St. Vincent offer the power of 2 hospitals for your heart's health. It's the most important organ in your body. The heartbeat can be detected as early as 12 weeks and continues to beat 100,000 times every day of your life. If you have a heart problem, come to the best heart program in Indiana, St. Vincent at Fayette Regional. Because all your life, your heart has been doing the best for you. Learn more about heart care at FayetteRegional.org, your community hospital.
Welcome back. Joining us now is Paul Hummel. Paul is the team leader for Fayette Regional's Laboratory Services. Thanks for joining us, Paul.
Thanks for inviting me.
Give us a quick overview of your experience, your work at FRHS and Laboratory Services at Fayette Regional.
I have over 35 years of experience as a medical technologist. I've been at Fayette for about 3 years now. The laboratory at Fayette offers a full variety of service from hematology to chemistry to microbiology and histology.
Before the commercial break, Renee talked about direct access testing. Can you explain in more detail what direct access testing is?
Direct access testing is a new service offered by Fayette Regional Health Systems for those individuals who are interested in being proactive in their health. The laboratory at Fayette is offering a selection of laboratory tests that are designed to evaluate the current health status via simple blood draw at discount prices. A physician order is not required.
I see. I see. Who benefits from this type of testing program?
This program is ideal for those individuals who are interested in monitoring their health, such as the cholesterol, blood sugar levels, and thyroid and other blood tests.
I'm sure you see a lot of testing in that area, I'm sure.
Oh, definitely.
What advantages does this provide for those interested in this type of service?
Renee, it offers the fact that you don't need a physician order. The results are mailed directly to the participant, and there's no appointment for the blood draw.
Okay. Are there any restrictions on when or where those screenings are offered?
The screenings are offered at the laboratory at the hospital. The laboratory is located on the main floor of the hospital, right off the emergency room entrance. Our hours are Monday through Friday from 8 to 5, and on Saturday from 7 to noon.
I'm sure you get this question a lot, but how are the tests paid for?
The tests are paid for at the time of the service. We cannot bill Medicare, Medicaid, or private insurances.
I see. I see. How can I share these results with my doctor?
All the results will be sent directly to the participants in this program. We can't release them by telephone or fax, and it's up to the participants to share those results with the physician. If there is any critical results that come up, it's up to the patient or the participant to share those with the doctors and to seek medical help as is appropriate.
I see.
So if a patient were to have a question about the actual lab results, is the lab available to interpret them?
No, we won't interpret them. We encourage the individuals to talk with their provider about the results.
Okay, related to that last question, how does the patient know what is normal and what that means?
The normal results are located on the results form themselves, and these are designed for the individuals that are in our area, and they'll vary by sex and by age. Again, we encourage individuals to share their results with their provider for the interpretation of those results.
Okay, that makes sense.
Paul, can you give us some examples of the tests that are offered?
Some of the tests that were offered is thyroid testing, for example, and that costs about $15 or $25. Iron profile is another one for those interested in if they have anemia. That's $25. CBC is for $15.
I see.
And Paul, how can someone find out more information about this whole program?
You can call the laboratory direct. Our phone number is 825-7704.
Okay, perfect. Thanks so much for stopping in and sharing such great information. I think it'll be very beneficial for our community to have this here.
You're welcome, Renee.
Thanks again, Paul. We'll be right back.
Fayette Regional is a leader in physical therapy and injury rehabilitation for life and sports. On the go, on the job, or on the court, the smallest of injuries can stop you in your tracks. That's why Fayette Regional is here for you with certified athletic trainers and physical therapists working with your doctor to develop your custom treatment plan. Quick treatment with Fayette Regional can lead to a quick recovery to get you back to the active life you enjoy. Learn more about physical therapy at FayetteRegional.org, your community hospital.
Welcome back. Joining us now is Dr. Matthew Locker, specialist in women's health, mammography, and breast imaging from Northwest Radiology. Thanks for coming in today, Dr. Locker.
Thank you very much, Doug, for having me.
It's good to have you. Let's start out by hearing a little bit about yourself and your specialty.
Sure. Well, my name's Matt Locker. I come from a small town in Indiana called Crawfordsville, about the same size as Connorsville. And I originally started in engineering at Purdue. I finished my master's in industrial engineering at Purdue up in West Lafayette. During that time, I worked with a couple businesses. I worked with Disney down in Orlando and Abbott Labs up in Chicago. And while I liked engineering, it was really the people that I was most drawn to. And as I got to the tail end of my experiences out in corporations, I decided to try for medical school. I got accepted. I went to Indiana University School of Medicine in Indianapolis. And after that, I fell in love with radiology. And most people, when they find out I'm a radiologist, they think that I'm the person who actually performs the X-rays. We're actually quite a bit different than that. We're the doctors that are sort of behind the scenes that interpret the X-rays, CTs, MRIs, mammograms, and anyway, I think it was the technical part of radiology that drew me into it, and eventually I went on to specialize in breast imaging, or mammography, as most people probably are used to hearing it.
Kind of a long trip, a roundabout long trip, wasn't it?
It has been a very long trip,
well,
but either way, it's good to be back in Indiana.
Well, it's great to have you here at Fayette. Can you give us some more information about Northwest Radiology, some of the locations, service areas, those types of things?
Yeah, absolutely. So Northwest Radiology is one of the largest radiology groups in the state of Indiana. We've been around, we actually just celebrated our 50th year anniversary of being in practice. And so we're made up of between 50 and 60 radiologists, many of which are subspecialized within the realm of radiology. So in today, basically radiologists can specialize and go beyond just general radiology and choose different specialties such as mammography or breast imaging, which happens to be my specialty. But there's many other specialties, about 9 or 10. There's musculoskeletal imaging for people who have bone lesions. There's chest imaging for looking at emphysema and lung cancer. There's neuroimaging for folks who look at the brain MRIs and CTs and spines. There's nuclear medicine imaging. There's interventional radiology. All of these are subspecialties within radiology. And today we're becoming very, very focused on one particular area as medicine is growing exponentially. It's hard to be a jack of all trades, and so we're becoming very honed in at where we're specializing at.
Yeah, I think you don't really realize that there are so many areas in just radiology. You just think of going in and getting tests, and it's a wide gamut of things that they go into all of it.
Absolutely, and it's rapidly progressing with the technology. Radiology is very technology dependent, and as that technology progresses and advances and becomes better, the information grows exponentially as well. So it's nice that we can focus in on one particular area, but change and advancement are par for the course, no doubt.
Right.
So with all of the radiologies that you're mentioning, what types of services does Northwest Radiology actually provide for Fayette?
Okay, great question. So here at Fayette, we provide basically all those different areas of subspecialization that I'd mentioned before. So I myself am a breast imager. I specialize in breast cancer. There's 2 or 3 other radiologists who also have done specialties in breast cancer, and we all come to Fayette Hospital to help out with the breast cancer screening program there, as well as some of their more advanced diagnostic imaging, even performing biopsies there at Fayette Hospital. But our entire group actually supports Fayette. So we have neuro radiologists who read all the brain imaging, all the spines. We have interventionalists or proceduralists who use radiology to do different small procedures within the body. Again, musculoskeletal, chest, nuclear medicine, body. I'm probably leaving 3 or 4 of the specialists off the list. Actually, I mean, the gamut is wide. But the nice thing about Northwest supporting Fayette is that the hospital gains access to all those subspecialists.
Right. Well, we are very fortunate to have you all on board.
We're happy to be here.
I understand that the mammography suite at Fayette Regional was recently remodeled. Do you have any details about that upgrade?
Yeah, very happy to tell you about that because I've kind of been a part of that, been very excited to see the progress that they've made there. So, not too long ago, Fayette Hospital was basically a 2D mammo unit, which has been around for the last 15 or 20 years. It provides us with very good quality mammographic images to read, but it is not the most recent and the latest and greatest. And Fayette Hospitals recently updated their system now with something called the Hologic Selenia unit, which takes 2D imaging to the next dimension, which is 3 dimensions. That unit is also digitally based, and so when you acquire all those images, they go into in sort of a computer that radiologists can access all over the state. And it's no longer, film screen where you hang a film on a light box and look at it. It's all on a computer. And having that capability, gives us a lot more opportunity to detect cancer early, treat it early. If you can't see it, it's really hard to treat it. And so with this new technology, we're able to see cancers when they're 3 and 4 millimeters in size. And so, the overall advancement of that unit it's unbelievable that we have that kind of technology here in Fayette now at our fingertips. And being a radiologist, it's nice to look at it. I kind of compare it to, if you need glasses if you're nearsighted and you need glasses to see, the landscape, the difference between seeing it before the glasses and after. Well, the 3D mammo unit, the hologic unit that they just installed at Fayette is sort of like putting on those glasses, and we're detecting things that you couldn't see before.
That's
so it's great.
awesome.
Yeah, with the new remodeled suite, and you talk about the new 3D equipment, is there any other new equipment that goes along with that?
Yeah, absolutely. After they installed the hologic unit, basically they've gained the ability to do biopsies with that unit. So just taking a step back, this hologic, this 3D mammogram allows us to take what was previously just a 2D image and look at it in 3 dimensions. So you can sort of put it in a stack and look throughout the tissue, kind of one slice at a time, sort of like what a CT does, but now at the level of the breast to determine if there's a cancer or not. And so tomosynthesis is what that is called, and you can really get in there and determine if that's normal tissue or if that's a developing cancer. And so with that ability, if you can only see it in the 3 dimensions and you find an abnormality, you want to be able to do a biopsy to prove what it is. It's one thing to see it on imaging, it's another thing to do a biopsy and prove that it is a cancer or it is just a benign area. Right. And so with the new tomosynthesis, the hologic unit here at Fayette, we do have the ability to perform these minimally invasive biopsies very efficiently, and it allows us to be sure we got the proper area.
Yeah, I see. You mentioned the tomosynthesis. Is that something new, or is that something new with what's going on now and things like that?
Yeah, it is. It's very new. So over the last 5 years, tomosynthesis has been studied in the literature. I actually did my residency down in Dallas, Texas, where they were one of the first locations to study this equipment. And over time, they showed a lot of advantages of using tomosynthesis to the point that now it's FDA approved. And so basically, tomosynthesis, the reason it's such an advantage is when you do a mammogram, it's hard to know if something's real or not. And in the past, we've had a lot of callbacks from screening mammograms for things that just weren't real. And that causes a lot of patient anxiety. I've had family members get called back and they get very upset and worked up. And
I'm sure.
The nice thing is the majority of those callbacks are needless and there's nothing there. It's just normal tissue or a benign area like a cyst. But what Tomo allows us to do is cut back on those callbacks. So we're not calling back nearly as many patients. And when they do get called back, we're finding things earlier at an earlier stage when it's much more treatable. Wow. And doesn't cause any kind of like long-term repercussions in a patient's life. So it's cutting back on the callbacks, and we're finding cancer more efficiently, more effectively earlier on.
Mm-hmm. Much more efficient, sounds like.
Yeah, those are great advantages. Does a tomo take any longer than the standard imaging that most are used to then?
It seems like it would, right? Because you have all these different slices of the breast itself, of the tissue. But it actually takes about the exact same time, and it's basically, instead of you can imagine an X-ray, which is just a single image, a 2D image. This one kind of moves around like this, like a CT scanner, and it develops a 3D image. But it really doesn't require that much more time. It doesn't have any patient discomfort. It's about the same experience as just having the same old mammogram that the patients had in the past.
Awesome.
Great, great. I'm sure many have asked, but does the tomo procedure cost more than the standard imaging?
You know, for patients that are currently on Medicare, Medicare covers the cost of the tomosynthesis. For patients that are private pay or that have other insurance, sometimes it will not be covered, in which case it's a small cost. I think it's on the order of $80. It's definitely less than $100 out of pocket. Yeah. So it's a real cost, but it's not, going to sink the piggy bank.
Sure.
It's not real significant.
Mm-hmm.
So with that being said, what would you say to anyone who asks if the potential cost difference is worth it?
That's a really good question. I think, in this day and age, there's a lot of discussion about breast density. Mm-hmm. And so that's a term that more and more patients are becoming aware of, and it's an important thing to be aware of because density refers to how much glandular tissue there is in the breast itself. And so the more glands there are, the wider they appear on the mammogram, the harder it is to detect an abnormality. So for women with very dense breast tissue, the tomosynthesis is very helpful. For women that have less dense tissue, or as we refer to it as fatty replaced breast tissue, it's really not necessary because the fatty tissue, you're able to see an abnormality very easily on just a 2D image on the old standard mammography. So, I think for patients as they're learning about their breast composition, and this will happen over time, and we're actually talking to patients about it when we do our screening mammograms. For women that tend to have more dense tissue, the tomosynthesis, I would say, is worth it. For women that don't have as dense tissue, it may not be worth it. Now, of course, if it's a Medicare patient and it's already covered, then I think absolutely they should have the tomosynthesis.
Right, mm-hmm. Right.
Absolutely.
So what would you say to anyone when recommending this screening compared to other units then?
The new tomosynthesis mm-hmm. unit that we have, it's as good as it gets. I mean, again, if you use the comparison of those glasses, putting on those glasses for the first time, patients depend on us as radiologists to find the cancers.
Right.
My mom was actually diagnosed with breast cancer when I started my residency. And as I went through residency, I kind of garnered a real appreciation of the radiologist who was behind the scenes reading that mammogram of my mom's to be able to find it. She was treated. She did really great. She's doing well today, several years later. But, it depends on our ability to find it, to see it. And the tomosynthesis, it's like having 20/20 vision. It's not perfect. No imaging modality can tell us 100% that right. There's a cancer there, but it's very, very sensitive, and we're very grateful to have it to allow us to find and then treat these breast cancers very early on.
Absolutely.
Yeah, definitely a great advantage. Great advantage. How can everyone find out about information about the program?
Well, there's a lot of different resources available. In general, a good resource is the American Cancer Society, but also the Society of Breast Imaging is another valuable resource that'll talk a little bit more about tomosynthesis and some of the imaging capabilities that exist. Of course, if patients come in to see us at Fayette, we have pamphlets available to teach them a little bit more about tomosynthesis. And then they could also refer to our website, Northwest Radiology. If they just type that into Google, they'll find us, right. And they'll learn more about breast imaging.
Right. Well, that's a lot of great information, Doctor. We really appreciate it. And thanks so much for stopping in and seeing us. And it was obviously great meeting you and learning all about what's going on at Fayette.
Absolutely.
It's exciting.
It is very exciting. Thank you so much for having me.
Yep.
Really appreciate it.
Fayette Regional offers the area's premier sleep medicine program with enhanced diagnostic testing in a comfortable home-like setting. 7 hours of restful sleep each night can help you live a longer, healthier life. However, millions suffer daily with sleep disorders that lead to health problems, including high blood pressure, stroke, and heart attacks. If you snore or gasp for air while asleep or are often tired during the day, don't ignore the warning signs. You may be a candidate for the Fayette Regional Sleep Program. Learn more about sleep studies at fayetteregional.org, your community hospital.
Welcome back. Before we wrap up this edition of Health Talk, we would like to give a quick rundown of some other upcoming events. As part of our continuing effort of community outreach, Fayette Regional provides monthly health screenings throughout the area. We will be at several Connorsville locations this month: the Fayette County Senior Center, Fountain Place Apartments, and Pattern Mill Apartments for blood pressure and blood sugar screenings. If your group or organization would like us to come to your facility or event, contact us at the email address on the screen. The second Tuesday of each month, Fayette Regional provides a free lunch and screenings at the Fayette County Senior Center. Lunch is served at 11:30. If you wish to attend, please make your reservation by calling the Fayette County Senior Center.
Please join the Fayette Regional staff and the community by supporting our blood drives throughout the year. There are 4 scheduled now through December. The next blood drive is Tuesday, June 6th from noon to 4. Visit our Facebook page for more information and tune in for TV3's listing of local events to find other special events that Fayette Regional is hosting in your area each month. And finally, spring has been very wet with severe temperature swings. If you find that you can't kick that springtime cold, Fayette Regional has extended hours for your primary and immediate care needs. Fayette Regional Primary Care Center has a full staff of experienced physicians and nurse practitioners. They can take care of all your immediate care needs 7 days a week, and walk-ins are welcome Monday through Friday, even on weekends, for adults, seniors, and kids too.
Well, that's all the time we have today.
We look forward to everyone joining us again next time on Fayette Regional's Health Talk. I'm Renee Nesbitt.
And I'm Doug Fischesser. Stay healthy, Connorsville.